Thank you, Dr. Ino. Good evening, everyone, and happy new month. It's nice to be here again today. So I'm trying to share my screen, but I think you're sharing your screen, so I can't share mine.
Oh, let me stop sharing.
Yeah. Okay. So, Dr. Ino, I think she has even taken our topic already. Maybe we should just close the session. But let me just, okay. So today's topic is quite an interesting one. It's alcoholic drinks. How much is too much? And for some people, the question would even be should we even take alcohol at all before getting to the stage of how much is now too much alcohol? And so that is what one of the things that we'll be talking about today. Thank you, Temitope, for the welcome. So let's just go right into it. So I just kept some images of different brands of alcohol. I'm sure you may be able to identify some of them by their colors. You can just, just leave some examples in the chat section so I can see if you are following. So what you think these bottles contain? Okay. All right, so just as a way of introduction, like I said, this is quite an interesting topic because there are many reasons why people take alcohol. And so for some, it might be because they are just social drinkers. So they take it during outings, probably on weekends when they're with their friends. While in the vast contrast for others, it might just be that they can't even help it. They're already dependent on alcohol. And several factors come in play in regards to alcohol intake, and which can be personal preference. Some, like, it's totally okay. Some decide just not to take it at all because of their personal preference. Some might be due to religion, why some can even be culture. There are some cultures where when they wake up in the morning, the first thing they would open like a bottle of spirit on the floor and all those type of things. It can also incorporate into one's personal lifestyle. While for others, it might just even be peer pressure. So I can see someone saying cognac, thank you, lower care. And so this was Sakele Water, thank you. So this was a survey that was done amongst the youth. And so one of the things that has been noticed is that alcohol intake usually starts from when we are young. And when a survey was carried out by the Center for Disease Control in America, so what was found was that at least one of every youth that they surveyed have had at least one alcoholic drink. And surprisingly, they had the drink before the age of 13. So you can see how very young the age of 13 is, because really in civilized countries, alcohol intake is usually regulated, meaning that someone less than 21 cannot just walk in there to buy alcohol. You're going to need to present an ID card. And so this means that they would have gotten it either from their parents, from an older friend. And one of the other things that was also found was that at least these youths that were surveyed have had 5 or more drinks in a room, meaning they took about 5 bottles at once. And so it's not only just about the alcohol intake, it's also about the quantity you also take at a sitting. And then in the last month, at least one of them had also had a drink. And so what are the 3 most influential factors for youth or teens? I'm sure most of us here might have children, have nephews, have nieces, or even when you flash back to when you were young, some of the things that are influential factors for starting alcohol. And so one of them, family. Probably you see your parents, your uncles, indulging in this activity. And so the other one could be, peer pressure, just like I said, in schools, especially hostels, campuses, higher institutions, even more recently, secondary school. So these are very influential factors in starting alcohol. And I just like I'm not sure who mentioned the sip my alcohol, media. So media has really, opened a lot of people eye to alcohol intake, like the popular song the alcohol song. And so it plays on people's emotion. It tries to just make it something cool and one of those normal things. And so that's what media has also done. And so media, either in music, in films, and so these are just like different, these are popular Hollywood actors and, taking their drinks and everything. And these are incorporated into daily things that we normally see. And so what is the fact, just to talk about some facts about alcohol. So, when we ask, okay, so let me just throw a question to the house. If you can just mention example of some drugs that common drugs that and the first thing that comes to your mind, what would it be? If someone should ask you, give me a name of a drug, so just put it in the chat section so I can see what you'll be thinking of. If someone should ask you for examples of common drug. And so, okay, let me just give an example here, paracetamol. So if I ask you an example of a drug, or someone already just said that paracetamol, so paracetamol comes to mind. Another thing that may come to your mind is, someone said tramadol, okay, tramadol. And so even normal medication. So those are some of the things that will come to your mind. And hardly would you even think of alcohol being a drug. But essentially, alcohol is actually a drug because it's a chemical substance that is taken and it causes changes in a person's body or behavior. And one of the ways that alcohol works is that it slows down the central nervous system. And so central nervous system is the brain, essentially. And so it just tries to reduces the activity of the brain. And if too much of it is consumed, vital functions can be affected and the person can even become unconscious or even lead to death. So I'm saying codeine, tramadol. Thank you everyone for your responses so far. And so just as you think about all these things, also essential that you just put it at the forefront of your mind that alcohol is also a type of drug, so that when an individual indulges in that, it brings it to the forefront of the brain that, oh, this is what I'm actually taking is a drug. It has the potential to cause changes in my body. And so I should be careful with the amount, the quantity, the strength that I am taking. And so alcohol, just a bit more fact, is produced through a process known as fermentation. The yeast feed on sugars from salt, grapes, or berries, and then the byproduct is carbon dioxide and alcohol. And so the very common question is there a safe limit? Is there a limit of alcohol intake that is considered safe? And so what the World Health Organization says is that there is no, they've done several studies and they can't say that, okay, if you take this amount, you'll be perfectly okay. But however, what they've also done is to come up with a guideline of how many quantities, how many units you should try to stay within in a week. And so this limit is the let me try and look for the word to put it. And so if you go above this limit, the risk increases. That does not mean that there's still no risk within that limit. It's just that the risk has been reduced, but the risk is definitely still present. And so just like I said, in civilized countries, it is illegal to purchase or possess alcohol if under 21. I'm sure that does not really apply to Nigeria because you can even just send the young child to, go to one of these bars and then they would purchase the alcohol for, and they would willingly give the alcohol to this child. And that's because we've still not thought about alcohol being a drug. And of course, there are some medical conditions that you are not even thinking of anything called safe limits because it's just going to worsen whatever it is the person have. And one of them is the liver. people who have disease, so one of them is liver disease. People who have diseases that affect the liver, either maybe chronic liver disease, or they have hepatitis, which can be some form of, can even be viral, caused by viruses, or even alcohol itself can cause the hepatitis. People who have brain-related disease. Remember I said that alcohol can serve as a form of depressant. It just reduces the activity of the brain. And so if you're already having brain-related disease or breathing problems, you should not even be thinking of alcohol at all, because there is no safe limit. Thank you, Dr. Aino. And so there are different types of alcohol, just like how we've mentioned earlier. We mentioned cognac, there's beer, there's wine, there's liquor. And so usually the alcohols, they always have these different type of alcoholic drinks, they have the percentage of alcohol usually imprinted in them. And the liver, like I said, the liver is the one that actually helps to clear this alcohol intake. And that is why it is one of the major organs that's usually affected in most of the cases. And so these are just different ways of measuring. So this wine bottle is about 5 ounces, and an ounce is about 30 mils. So this is about 150 mils. This is about 45 mils, 1.5 ounces. So this 12 ounces is like 30 times 12, about 600 mils. So these are just different ways of grading alcohol intake. So we'll move on to what is the recommended alcohol intake, the guidelines that have been made. And this is not to say that with this there is no risk at all. No, it's just saying that you should watch it. You should not exceed this particular unit, because then your risk then becomes increasingly proportional. And so I'll just be asking, just be calling on different people, anyone that wants to volunteer. So there's actually a calculator you can just use to calculate it. But let me just show, just to state what it is. And so both men and women are advised not to drink more than 14 units a week. So 14 units of alcoholic drinks a week. And roughly 14 units is equivalent to about 6 pints of average strength beer, or about 10 small glasses of lower strength wine. So usually, and so because I said 14 does not mean you would have to take the 14 at the same time at once. No, that would lead to alcohol poisoning. And so you need to spread it over 3 or more days, and you should have a drink-free day in between. And especially for people that want to cut down, have drink-free days in between. I remember I mentioned there are some categories that you should not even take alcohol at all. And one of them is people who are pregnant. And so we'll talk about what would happen eventually as we go on. People who are pregnant, or they're trying to become pregnant. There's no 2 ways about it. It's not safe for both the individual and then the child. Okay, so like I said, so let me share my calculator. So we just give some different examples of what people take and different examples of what people take, so that we can then, okay, so this is like a website. I will try and copy it and then paste it in I don't know if you can see this website screen.
No.
Okay. Let me stop sharing this slide and then share the website screen. Okay, so can you see it now?
Yes, we can.
Okay. So I've pasted the link on the chat limit. So I don't know if anyone wants to volunteer, so we can try and calculate together what your unit is in a week, so that we can have a clear understanding of how it works. Does anyone want to volunteer? Anyone? So it's just answering some questions. And so you would see there is bottle of larger beer that contains 5% alcohol and 330 ml. So like, if it's estimating a week, how many do you normally take? And so we'll just keep answering the questions one after the other, and then it gives us a calculation of how many units you've taken that week. So I don't know there's anyone that wants to try. Let me see. Mr. Dele Kiolufemi, if you don't mind,
Someone has raised her hand.
Oh, yeah. I didn't see that. Okay, please unmute yourself if you raised your hand.
Yes, I did.
Oh, okay, thank you.
Yeah.
Okay, thank you, Mrs. Folashade. Okay, so let's just answer the questions together. So the gender is female, am I correct?
Female, yes.
Okay, so about 5% like larger beer, 330. Can you see the bottle? So 330 mils. So like in a week, how many of this quantity do you think you take?
0.
0. Okay. How about the 5.5% alcohol can?
0.
About 5.0. Okay. What about the lower strength larger beer?
0.
0. Okay. What about the higher strength, the one that contains 5.2%?
0.
So everything is 0. So we're already getting to 0, 0, 0. Pints of higher strength larger beer, the ones that contain 5.2%.
0.
0. What about a glass of wine?
I seldom.
How many glasses?
Most of the time I take non-alcoholic wine.
Okay.
When it's 12%, it's a bit on the high side, and I'm not a party person. So I recent times I've not partied for months now. So I can't, but sometimes I take wine.
Okay.
Sometimes I take Bailey's Irish cream, but that is when just a little, because I'm so bad in alcohol. When I smell it, I used to tell my husband that smelling it alone, I'm drunk.
Okay. So should we just say one small glass of wine?
Maybe one small glass of wine maybe once in can be once in a month.
Okay. So so there's the fortified wines, like examples are like brandy, examples of fortified wine. So should I put 0, or do you have like
0?
a
I can't take spirits. I can't take all those things. I cannot.
Okay. What about spirit?
No.
Okay. And so this alcohol pop just means like alcoholic beverages. There's like Smirnoff, Origin, just those beverages that contain alcohol.
Yes, it's only when I go out, when I go to functions, I don't indulge at home. I only take water. I don't even take malts. I don't take minerals.
So let's assume when you go to parties, like how many of these alcohol pop would you normally take?
Maybe just one bottle. I might not even finish a bottle. Sometimes I mix with water.
Okay, that's actually, mixing with water is very good. So it's one of the things that is also on my slide. Okay, so let me just use, so it's just 2 that has about 1. And so based on what you told me, everything here is about 3 units. So that's why
it's not per week. I can't drink all these things per week.
Yes, I understand. And so that's why I say your drinking is within the recommended guidelines, and you're less likely to develop alcohol-related problems. So this is just like a guide. Yes, thank you very much for volunteering. I don't know if any other person wants to go. One more person that, especially if you maybe take more than Mrs. Folashade, if any other person wants to go. Okay, let me stop sharing this screen and then continue with this slide.
Can I volunteer?
Yes, please.
My name is Engineer.
Okay, welcome and thank you. So, so you're a female, am I correct?
Yes, I am. Once in a while, I take spirit with my husband.
Spirit. Okay, so let me go to the part for spirit. So, like in a week, how many? There's a single shot, standard shot, double shot. So the percentages and the meals of is it 25 meals? 35 mils, 50 mils, like which of them do you think you take?
35 mils.
Sorry, 25 mils.
35
okay,
mils.
So like how many shots?
Like once a while.
One shot, okay. How about fortified wine? Like brandy?
No.
What about normal alcoholic wine?
Very rarely.
So the very rarely, is it a small glass?
Social drinker, small glass, yeah.
Okay, so like how many small glasses?
It's not small glass, so like what the visual I'm seeing here is one large glass of wine. That's 250 ml, I think, like that.
The 250 mils, oh, okay. So how many of that? Just one?
Just one.
Okay. How about like beer?
No.
Okay, so that means every other thing there will be 0. So let's just try and calculate what yours will be. So yours is about 4 units. So it's still well within the recommended guideline.
Okay.
All right. So thank you very much for volunteering. Okay, so let me continue with the slide presentation. Okay. Okay, so this is where we are. We talked about the recommended units, so about 14 units a week, and you can make use of that site I shared in the chat to calculate it. And it's also very important that you spread it over 3 or more days, and you should have several drink-free days. And most especially if the individual is pregnant or trying to get pregnant, they should not take it at all. So one of the ways that you can know that the individual is probably misusing alcohol is some of the things I've listed one. And so if you naturally just feel that you should even cut down on your drinking, it's already a sign that you think that there's something wrong. Or if after taking alcohol, you feel bad or you feel guilty, or if other people around you have, when they tell you to reduce your drinking, it gets you hungry. Or one of the other ways you can also know is when you wake up in the morning and you cannot function without taking alcohol. So those are like very important signs that one should also be aware of. And one other thing is something that we call withdrawal symptom, and that is when the individual doesn't take alcohol for a long time, for some time, they start experiencing, their hands start shaking, they're sweating, they're saying things that other people cannot see. And so these are what we just call withdrawal symptom, meaning their body has gotten used to the alcohol. And so if they don't take it, they now begin to have some symptoms. And so another thing is something we call tolerance. And so usually people that take alcohol to get high, let's assume they take just one glass of alcohol, they find out that over time, this one glass of alcohol doesn't give them the same effect. They would have to increase it to about 2 glasses, 3 glasses, so 3 glasses. So these are very, very important signs. If you know anyone around you that it is also very important to pay attention to. This could be a sign that the individual is already getting addicted. And so what are the adverse effects? It can be short-term, it can be long-term. And so this picture here is just in form of a glass, just shows the different things: anxiety, alcohol abuse. And so we just talk about them in more details. And so remember I said that it works on the brain, and then the brain is important for judgment, is important for self-control. And so what this alcohol does is that it causes impairment of these things. So person cannot accurately judge something. And so usually if you are walking on the road and then you see a car or something, your brain, the normal brain instinct is not for you to go into the car and then get it, but because alcohol already because alcohol already interferes with normal brain function, and so the person, what you should not naturally be afraid of, the person is no longer afraid, and so the person can just walk into an incoming vehicle or the likes. Person may become violent, and in some cases there might be loss of self-control, especially in sexual relations. And so what has been found that they're less likely to use a condom, and so they are more prone to getting sexually transmitted infections. They act foolish or silly, and sometimes they even experience something we call blackouts, meaning they cannot even remember what has happened before, because the brain has lost the ability to make memories, and so they may unknowingly hurt themselves or others. And even aside all this, there's always there's this popular phrase that you should not drink and drive. And so because driving while drunk can increase the risk of being an accident, which can then increase the risk of the individual needing, hospital treatment. And remember that I said the person is not really aware, and so it's very easy for you to lose your personal possessions like wallet, keys, mobile phone. And even in severe cases, especially if you are taking a very large quantity at the same time, maybe the person is involved in drinking games or binge drinking, it can lead to seizures. That's like convulsion, vomiting, and then even person is no longer conscious. And when it affects the brain, usually, remember I said that these practices usually start from the young, and so the brain is still developing, and so it can really have like a very negative impact on the brain. And over time, it can even increase the risk of the person having dementia. And so usually dementia means that if you watch those movies where those elderly people can no longer remember their family or friends, they can't even remember past events. And so alcohol is one of the things that can cause that. And so one other thing is when I talked about pregnancy, so there is a phenomenon known as the fetal alcohol syndrome. So meaning when a pregnant woman delivers, and the pregnant woman takes alcohol during that time, the baby is prone to having some issues with the heart, the faces might not form well, and if the child is growing, there might be some delay, both in the social and the emotional part of the child. Of the child's life, and it can also cause some form of mental impairment. And so that's why it's really good to, at that stage, there's no safe limit at all. It's something you should just avoid totally. And so remember I talked about the liver being the major organ that, helps to clear alcohol intake. And usually over time, the alcohol interferes with the liver ability to break fat. And so then the liver begins, so if you look at this is the picture of a normal liver. I don't know if you can see my cursor. You can see this fine structure. It's smooth. And then this other one, you can see some like lumps all over the liver. So that's like a liver with cirrhosis. So these fats, when the liver begins to fill with fats, they now turn to like a scar. And then usually the medical name is something we call cirrhosis. And so this picture here is just some of the symptoms. The person's eyes may become yellow. So that's like jaundice. So those are some of the symptoms that can happen in cases of liver damage. And so just like Dr. Aino said, it can also cause heart disease, can increase the risk of the person having high blood pressure, can having an increased heart rate, can also cause some fatty deposits in the heart muscle, and overall just really not good for the person. And so the other thing is some digestive problem because the alcohol will need to be consumed through the mouth, to the throat, to the food pipe, then the stomach. It can increase the risk of cancer occurring in any of these regions, either in the tongue, the mouth, the food pipe, the stomach, and it can even cause ulcers. And then if the ulcers become really terrible, it can even cause bleeding. The person might be vomiting blood or stooling blood. And so this is why it's always very important for us to to watch our alcohol intake. And so these are just some simple tips I've written here for people who have exceeded the recommended intake and really want to cut down. So they want to make a plan and then set a limit on the number of the drinks. So of course, one of the things you can also do is to set a budget. Even with this our economy, you know that you don't want to spend more than this so amount in a month. And so once you've gotten over that amount, you know that you'll not be buying alcohol again for that month. And so it's always very important to tell your loved ones, because they can serve as like a very good motivator, and then they can caution the individual once the individual is getting out of hand. And so just like how she, one of the others contributor mentions that she also takes water. So it's also very good. You can just take a cup of water before you take your alcohol drink, and then you can just alternate it. And when we're talking about the different strengths, and so there are some that the percentage of alcohol is higher. So you can always just take the lower strength alcohol. Instead of taking about a bottle, you can reduce like a glass, you can, and so just continue cutting back each day. And so remember I said that for some people they cannot help it, and so for these ones they might need more help than all this. So they might need like a specialist help, which we call like the psychologist, who can then plan some detoxification programs for the person. Person might need to undergo some rehabilitation and some support groups. So one of them can be like people who have, had this kind of experience, and just to share their experiences and how they overcame it, and can also be talking therapy. And so these are like the various means that can be really helpful, because the adverse effect of alcohol is not just, it doesn't just affect the person's physical health, it can also cause some social problems like unemployment. So let's assume someone is always going to work drunk, because it's just a matter of time the person will become unemployed, and it can also cause troubles between couples, people in relationship. And so that is why it's always very important to have all what we've said in mind. So I think that's about what I have for today. Thank you for listening, and I hope we all got at least one thing to take away.
Thank you so much, Dr. Gloria Ben-Oko, for that presentation. Do we have any questions before we move on to the next segment of this this meeting today? If anybody has a question, please put up your hand or type it in the chat box if we have any questions.